So I wanted to come back to the discussion we were just having. I just didn't want to leave that part out, which is what you're starting to describe there is a patient journey, right? Which is a combination of the patient's symptoms, their diagnosis, then, the complications, the clinical path they go through, and that includes the psychosocial parts of it. So can we have a conversation here based on what you see diagnostically in terms of, presentation, age, and then some of the ways that the patients transverse the system?
Sure. So from the clinical side, the patient's journey for me starts with the newborn screen coming back positive, and that first visit with a parent where we discuss what sickle cell disease is. Oftentimes we're discussing this with patients with parents, I should say, that have never seen sickle cell disease. They know they have the trait, but they've never actually seen the disease. That's where the journey starts for us. And in pediatrics, we're fortunate where we do have some ability to administer preventative medicine in the form of antibiotics, in the form of vaccinations. And we're very lucky to have parents as clinical team members to keep a close eye on these individuals. And it makes a very big difference to have a parent who's involved and present and the outcome that a child is going to have. The patient journey, of course, includes the setting at home and the setting in which, really I'm going to back up a little bit here and I'm going to say that oftentimes more important than your genetic code, unfortunately, with sickle cell disease is your zip code. And that is sort of a tragedy in the United States of America, where just because you were born in an area where you don't have access to care, you are going to have a poor outcome, which is quite unfortunate, especially in a disease as complicated and complex as sickle cell disease. We get to watch these children go through early life, and fortunately, majority of them don't have terrible outcomes initially. But we do see the kids that have strokes and how that affects their lives, ranging from a silent stroke to patients that I have who are paraplegic and unable to speak. So depending on each individual has a different journey, but every journey comes with its unique challenges.
I would just add to that, especially a child starting out, one, there's the fear and anxiety of what lies ahead for that child, even from a parent. But as that child starts to get older and is not able to participate in the same activities or sports or other school events that may go on, especially if there's other complications, either infection or either a stroke that occurs as that child begins to age. So.
I think another opportunity, certainly in the realm of screening, is genetic counseling, right? And prenatally, to be able to offer an amnio so that, again, you're preparing for what's to come and hopefully get into the system in terms of access and understanding what's going to be needed as the child grows in their lifelong journey.
And if you don't have children where the initial starting point is the screen, right? They say they weren't screened or something got missed or what have you, right? At what age do you start to see symptoms? And then if they aren't picked up initially on the screening, how does that change their journey? What should trigger testing? What should parents look for?
Sure. The range of symptoms that you see is quite variable, but we know that our most severe patients generally present in the first year of life, generally between 6 months and 12 months with what we call dactylitis most frequently, which is swelling and vasal occlusion, pain in the hands and feet. Those individuals become high priority for clinicians because we've known from sort of anecdotally and historical data that those are the children that will have a higher risk disease. If you're fortunate enough to make it through your first year of life without having these issues, in general, we don't start seeing issues until generally between 6 and 10 years old, I would say, is really when patients become aware of pain and how the pain that they're feeling might not be something that they should be feeling. And that would be the most common presentation, is someone who comes in to your ER or to your office with pain, possibly an enlarged spleen, and potentially difficulty breathing. These would be the sort of the classic ways that a patient would present had you not known that they had sickle cell disease.